Now, if you ever see someone tell you a few simple points to relieve shoulder pain, they're either in fairyland or feeding you garbage. Now, they did a study of 72 people with shoulder pain, and this is what they found. Now, each line represents a different muscle, and the scale across the bottom represents how many people out of the 72 had a problem with that muscle. So, if we're going to help your shoulder muscles, we've got some work to do. Now, to make it easy for you, we've grouped some of the muscles together, plus we've got a list of the times so they're easy to find. For the first demonstration, we'll group three of the most important muscles together: Infraspinatus, Teres Minor and Teres Major. Now, as this diagram shows, they're at the back of your shoulder blade. And these diagrams show where the common trigger points are. Now, the X's are the trigger points, and the red is where they usually shoot pain to. Now, you can reach around and find the trigger points, but it can be a bit of a stretch. Now, looking back at the chart of what the scientists found, most people with shoulder pain will have a problem here, so I just apply the massager and let it find the tight spots and the trigger points. Now, when you massage these muscles, it's good to put your arm up like this, so the muscles here are easy to access. Now, you can do it sitting, but I prefer laying on my side rolling slightly forward, and that gets the part horizontal. Now, the big part of the back of your shoulder blade is the infraspinatus, but if you come forward towards the edge of your shoulder blade, you'll find the other two muscles. Now, just work this area systematically, and if you find part that's a bit tight or a bit tender, just leave the machine on and give it a good soak with vibrations. Now, while we're in this position, we can easily do our triceps muscle. Now, as this pic shows, this goes in the back of your arm from your shoulder to your elbow. So, once you finish the back of the muscles at your shoulder blade, you can just gradually work up the back of your arm towards your elbow. Again, I'm not bothering with a pre-examination of the muscle. If I feel a massager finds a bit that's a bit tight or tender, leave the vibrations on to soak for a bit. Now, the next ones we'll do are the upper trapezius muscle and supraspinatus. Now, as this diagram shows, the upper trapezius runs across the top of your shoulders up the side of your neck. Now, according to the scientists, this was the second most common problem muscle for shoulder pain. Now, supraspinatus sits underneath the upper trapezius muscle in a groove at the top of your shoulder blade. Now, these are very easy to reach and examine for trigger points. Now, the trapezius is at the top, so you can easily start with the flats of your fingers, but the supraspinatus is in a groove, so you need to curl your fingers a bit to get to it. Now, I massage these sitting up, holding the massager with the opposite hand so the muscles I'm massaging are relaxed. Now, if I sit straight up, you see the muscles on a slope, so I need to grip the massager so it doesn't slide off. But if I lean across and slightly forward, it makes the part a lot more horizontal, so it's a lot easier to hold. Now, what you can do now is move over the muscle systematically, giving anything you find a good soak. Now, when you're over the top of the supraspinatus, just remember that it's deep in a groove, so give it a good soak. Now, next we'll do the deltoid muscles. Now, as these diagrams show, they run from your shoulder to part way down your arm. There's part in front, part at the side, and part at the back. Now, these are easy to reach and examine, and the easiest way to massage these is laying on your side. Now, you roll backwards a bit for the front part, on your side for the side part, and forward for the back part of the muscle. Now, again, work systematically and give anything you find a good soak. Now, the next muscle we'll look at are the middle and lower parts of the trapezius muscle. Now, as you can see, these are a big sheet of muscle across your back. Now, the easiest way to massage these is to lean forward, supporting yourself with your elbow, and just systematically cover the whole part of your muscle. Now, your biceps muscle is very easy to massage. It sits at the front of your arm, running from your shoulder to your elbow, so it's very easy to reach and examine. Now, to massage the muscle, I just have the massager in the palm of my hand and go over the muscle systematically. Now, pec muscles are also really easy to examine and massage. Now, as these diagrams show, the biggest muscle, pectoralis major, sits on the top, running from the centre of your chest to the top of your arm, while the pectoralis minor runs underneath the outer part, running roughly vertical. Now, you can do these lying on your back to use gravity, but I like to just grip the machine like this and apply the massage. Just 2 more muscles to go. Now, there's a muscle sitting under your shoulder blade called subscapularis. Now, it normally sits between your ribs and your shoulder blade where you can't get to it, but if you bring your arm up like this, your shoulder blade sticks out and you can get to it a bit. Now, with every other muscle, I've used the flat head on the massage to get the best vibration transfer, but because this one is hard to get, I'm going to use the domed attachment. What I do is sit the head in there to get the best access I can. Now, this is where you'll be really glad using a vibration massager. Now, you'll never be able to poke your fingers or thumbs in far enough to get effective massage to this muscle, but the vibrations will soak in. Now, that said, it's difficult and there are a lot of sensitive structures there, so I definitely recommend getting a professional to show you to make sure you're doing it correctly. Now, the last muscles are the scalenes that run deep along the side of your neck. Now, scientists have found that these were the least important of the 17 muscles, which is a good thing because I don't want yourself massaging them. They sit on top of sharp pointed parts of your spine, right next to some major nerves and blood vessels. Now, leave these ones to the professionals. So, how do you find a decent massager? Now, I'll link an article above with full details, but they're not that common though. Now, most of the massagers on the market are either ineffective consumer massagers, massage guns, or both. Now, that's why a while back, to get something decent for our patients, we built our own, which are the machines I've used here. Now, this is our general purpose massager. We've had them for over a decade and they're widely used and recommended by professionals across a number of countries. They're very solid and reliable. Now, the business end delivers strong therapeutic vibrations and they have an ergonomically designed handle so you can easily use it anywhere on your body. Now, they do a fantastic job, but they're limited to what's under the head, which is why we built our quad massagers. Now, as you can see, they've got 4 heads, so you can do a larger area at a time. Now, I'll pop a link above to more info about how to get one. If you have any questions or comments, please email them or leave them in the comments. Hey, thanks very much for watching. It's been most appreciated.